The use of opioids certainly had reached a high level over the past few decades for a lot of reasons. And it became apparent to the medical community that this was a bad thing to have opioids used in excess. So there's a very strong current trend to reduce opioids, certainly not to eliminate them. They have a place and they have a use, but to supplement them with adjuvant therapy to help improve outcomes, reduce complications, reduce side effects, and overall improve patient satisfaction, something you don't really see with just a pure, heavy use of opioids in most patients. At the same time, I would caution that we don't necessarily understand the ramifications of mixing a lot of different adjuvant agents together. And a lot of research needs to be done to find the ideal dosing, the ideal time to give certain medications, and how they should be handled overall.
We like to use the word multi in front of a lot of different things when it comes to acute pain management. Multidisciplinary, multimodal, multi-mechanistic. And we have to remember that in order to actually achieve this in the hospital setting or at an outpatient ambulatory setting, we have to have buy-in from all the stakeholders. And that buy-in includes the patients. If you're going to suggest that upon discharge from the hospital that a patient takes a loose dose combination of various analgesics, remember that this may be somewhat difficult for them, and compliance can be a real issue. Those patients probably are taking other types of medications, the medications they came in on before their surgery, for their other comorbidities. They may be taking antibiotics, antiemetics. So all of a sudden, you send the patient home with a cacophony of medications. And that's just, problematic. So I think what we need to do is we need to establish empirical data that tells us that these are the right combinations, that these combinations provide increased effectiveness and reasonable safety, and that patients can comply to them. Because you could have the best regimen on paper, but if people aren't able to comply to it, then what good is it?